HIV stands for Human Immunodeficiency Virus. It is a virus that specifically targets the human immune system, making it harder for the body to defend itself against diseases and infections. HIV is a major global health issue, affecting millions of people around the world, and understanding how it works is crucial for prevention and treatment. This virus attacks the immune system, which is our body's defense system against diseases. The immune system is responsible for identifying and destroying harmful invaders, such as viruses, bacteria, and other pathogens that can make us sick. The immune system is a complex network of cells, tissues, and organs that work together to protect us from infections and illnesses. It includes important components like the lymph nodes, spleen, bone marrow, and a variety of specialized cells that all play unique roles in keeping us healthy. Think of your immune system as an army, always on guard and ready to defend your body from any threats. Each part of this army has a specific job, working together to keep you safe. This army has soldiers called white blood cells that fight off invaders like viruses and bacteria. These white blood cells patrol your body, searching for anything that doesn't belong, and launching attacks to destroy harmful germs. When HIV enters the body, it specifically targets and destroys a type of white blood cell called CD4+ T cells. These cells are essential for a healthy immune response, and without them, the body's ability to fight off infections is greatly reduced. These CD4+ T cells are like the generals of the immune system, coordinating the body's defenses and sending signals to other immune cells to attack and destroy invaders. Without enough of these generals, the immune system becomes disorganized and much less effective. As HIV destroys more CD4+ T cells over time, the immune system becomes weaker and less able to protect the body. This gradual loss of immune strength makes it harder for the body to fight off even common infections or illnesses that would normally be easy to overcome. This weakened state is what eventually leads to AIDS, or acquired immune deficiency syndrome. AIDS is the most advanced stage of HIV infection, when the immune system is severely damaged. Without a strong immune system, even minor illnesses can become serious and life-threatening. Simple infections like a cold or flu can turn into major health problems. People with AIDS are more susceptible to opportunistic infections, which are infections that don't usually cause illness in people with healthy immune systems. These infections can be very difficult to treat and can lead to serious complications, making it essential to protect and support the immune system as much as possible. Lymph nodes are small bean-shaped organs that are part of the lymphatic system. The lymphatic system is a network of vessels and tissues that helps to remove toxins and waste from the body. It also plays a crucial role in immunity. Lymph nodes are located throughout the body, including under the arms, in the neck, groin, and abdomen. They act as filters, trapping and destroying harmful substances like bacteria, viruses, and cancer cells. Inside lymph nodes, white blood cells congregate and work to fight off infection. When you have an infection or illness, the lymph nodes near the affected area may swell as they work harder to fight it off. This swelling is a sign that your immune system is active and responding to the threat. Swollen lymph nodes under the arm, also known as axillary lymph nodes, are a common occurrence that many people experience at some point in their lives. These small, bean-shaped glands play a vital role in your immune system, helping your body fight off infections and filter out harmful substances. Swelling in these nodes can be caused by a variety of factors, and in most cases the reasons are harmless, and the swelling resolves on its own without any need for medical intervention. It's natural to feel concerned when you notice a lump or swelling, but it's important to remember that this is often a sign that your body is working to protect you. Let's take a closer look at some of the main causes of swollen axillary lymph nodes, so you can better understand what might be happening in your body. Infections are by far the most common cause. When your body is fighting off an infection, whether it's a bacterial infection like cellulitis or a simple viral infection such as the common cold or flu, your lymph nodes can become enlarged as they trap and destroy germs. Even minor skin infections or localized rashes near the arm can trigger this response. Injury or trauma to the arm or hand is another possible cause. If you've recently had a cut, scrape, or bruise, your body may send extra white blood cells to the area to help with healing, which can cause the lymph nodes in your armpit to swell temporarily. This is a normal part of the healing process and usually subsides as the injury heals. Sometimes, swollen lymph nodes can be a sign of an immune system disorder. Conditions like lupus or rheumatoid arthritis cause the immune system to mistakenly attack the body's own tissues, leading to chronic inflammation and swelling in various parts of the body, including the lymph nodes. These disorders often come with other symptoms, such as joint pain or fatigue. In rare cases, swollen lymph nodes may be a sign of cancer. Lymphoma, a type of cancer that originates in the lymphatic system, can cause persistent swelling in the nodes. Other cancers, such as breast cancer or leukemia, can also sometimes lead to enlarged lymph nodes in the armpit. However, it's important to remember that cancer is a much less common cause compared to infections or injuries. Most of the time, swollen lymph nodes are temporary and not a cause for concern. They often return to their normal size once the underlying issue has resolved, and many people may not even notice the swelling at all. However, if you notice that the swelling persists for several weeks, becomes very large, or is accompanied by other symptoms like fever, night sweats, or unexplained weight loss, it's crucial to consult with a doctor. Getting a professional evaluation can help determine the underlying cause and ensure you get the right care if needed. HIV can cause swollen lymph nodes, especially during the early stages of the infection. This is because the virus is actively replicating and spreading in the body, triggering an immune response. The lymph nodes, being a key part of the immune system, become enlarged as they try to fight off the virus. During the initial infection phase, which can last a few weeks, people with HIV may experience flu-like symptoms, such as fever, fatigue, sore throat, and swollen lymph nodes. These symptoms are often mistaken for other common illnesses, making it crucial to get tested if you suspect you may have been exposed to HIV. In the chronic stage of HIV, which can last for many years, the virus continues to replicate at lower levels. Lymph node swelling may persist or come and go. Other symptoms during this stage can include persistent fatigue, weight loss, and recurring infections. While HIV can cause swollen lymph nodes, it's important to remember that, many other conditions can cause this symptom too. Swollen lymph nodes are actually a very common sign that your body is fighting something off, and they can be triggered by a wide range of health issues, not just HIV. So if you or someone you know notices swollen lymph nodes, don't jump to conclusions or panic. Instead, let's explore the many possible reasons behind this symptom. Let's take a closer look at some of these conditions. First, there are infections. Infections are actually the most common cause of swollen lymph nodes, and they can be caused by bacteria, viruses, or even fungi. Bacterial infections like strep throat, skin infections, and even dental abscesses can all lead to swollen lymph nodes as your body tries to fight off the invading germs. And ear infections are really common culprits of swollen lymph nodes, especially in children, but adults can get them too. Viral infections such as the flu, mononucleosis, also known as mono, can also cause your lymph nodes to become enlarged and tender. And chickenpox can also cause swelling. Even common colds or respiratory viruses can make your lymph nodes react, especially those in your neck and under your jaw. Then we have autoimmune diseases. These include lupus, rheumatoid arthritis, and Sjogren's syndrome. In these conditions, the immune system mistakenly attacks healthy tissues, which can lead to chronic inflammation. In these cases, the immune system actually attacks the body's own tissues, which can lead to inflammation and, swelling in the lymph nodes. Cancers are another possibility, though less common than infections or autoimmune causes. Certain types of cancer, like lymphoma, can start in the lymph nodes themselves, causing them to grow larger and sometimes feel hard or rubbery. And leukemia, a cancer of the blood and bone marrow, can affect the lymph nodes directly, causing them to swell as abnormal cells build up. Other cancers, such as breast cancer, can spread to nearby lymph nodes as well. This is why doctors often check lymph nodes when diagnosing or staging cancer. And even local skin issues like minor skin irritations, think cuts, insect bites, or small infections, can cause the nearby lymph nodes to swell as your body responds to the irritation or injury. Allergic reactions, whether from food, medication, or environmental triggers, can also cause swelling in the lymph nodes, especially if the reaction is strong or ongoing. It's essential to consult with a doctor to determine the underlying cause of swollen lymph nodes. While most causes are not serious, some do require prompt medical attention. They can perform a physical exam, review your medical history, and ask about any other symptoms you might be experiencing like fever, night sweats, or unexplained weight loss. And if needed, your doctor may order blood tests, imaging, or even a biopsy to make an accurate diagnosis. Remember, swollen lymph nodes are a sign that your body is working hard to protect you, but it's always best to get them checked out if you're unsure. or if they last more than a couple of weeks. While most cases of swollen lymph nodes aren't serious, there are definitely times when it's important to seek medical attention. You should see a doctor if the swelling is severe or doesn't improve within, say, 2 weeks. Also, if the lymph nodes feel hard or rubbery, or if they are fixed in place, that's a sign to get checked out. If you have other symptoms, such as fever, night sweats, unexplained weight loss, or fatigue, you really shouldn't ignore those. And if you have a history of cancer or a weakened immune system, it's especially important to be cautious. It's always better to err on the side of caution and consult with a healthcare professional if you have any concerns about your health. If you're concerned that you may have been exposed to HIV, it's crucial to get tested. HIV testing is the only way to know for sure if you have the virus. Early detection and diagnosis are essential for starting treatment and preventing the progression of the disease. The good news is that HIV testing is readily available and confidential. You can get tested at your doctor's office, a local health clinic, or even purchase a home testing kit. Modern HIV treatment involves taking antiretroviral therapy, or ART. ART helps to control the virus and prevents it from damaging the immune system. And when taken consistently as prescribed, RT can suppress the virus to undetectable levels, which means it can no longer be transmitted to others. Swollen lymph nodes can be a warning sign of various conditions, but they're not always a cause for alarm. Most of the time they're simply a sign that your immune system is working to fight off an infection or illness. However, it's crucial to be aware of the potential causes of swollen lymph nodes, including HIV. If you notice any unusual or persistent swelling, don't hesitate to consult with a doctor. They can provide an accurate diagnosis and recommend the appropriate treatment. Remember, early detection and intervention are key to managing any health condition effectively.